Today we'll be talking about the effect of therapeutic ultrasound on muscle contusions in field hockey players. By show of hands, who has ever gotten a contusion? So that looks like mostly everybody. In layman's terms, a contusion is just a bruise. This is a collection of ruptured blood vessels due to an impact or a force. Following this force, lymphocytes and macrophages rush into the area to help start repairing it. This starts the healing process, which has 3 phases, including degeneration, inflammation, and regeneration. This helps to regenerate muscle cells and repair the tissue. Between 2 and 3 weeks post-injury, scar tissue begins to form. This scar tissue can be very debilitating and can cause a decrease in range of motion and chronic pain in the area. It's important to start treatment for contusions as soon as possible following the injury to help decrease the amount of scar tissue to build up. Modalities and range of motion exercises can help assist in reducing scar tissue. Second to soccer, field hockey is one of the most popular team sports in the world, consisting of community, high school, collegiate, and national teams. The only protection worn by field hockey players are shin guards and mouth guards. An exception, the goalie is covered from head to toe in pads, including wearing a helmet. Contusions are the second most common injury, second to ankle sprains, in field hockey players. These contusions make up 17.1% of all injuries in field hockey. The most common causes of these contusions are due to opposing players' sticks and balls, especially during shots on goal. The most common areas of contusions are the anterior tibia or shin, even through the shin guards, the quadriceps muscle, and the head. So how do you treat contusions? NSAIDs are commonly used to help reduce pain and decrease inflammation. Compression wraps are also used to help push inflammation out of the injured area. Anabolic steroids and corticosteroids also help with pain. Finally, therapeutic ultrasound can help reduce pain and decrease inflammation. I'm going to be focusing on therapeutic ultrasound. Therapeutic ultrasound is the most commonly used electrophysical agent in clinical practice. This is used to enhance skeletal muscle healing process by enhancing regeneration of the muscle cells. Therapeutic ultrasound uses an alternating current produced by a crystal to deliver thermal or non-thermal effects depending on the treatment goal. This current enters the body through longitudinal waves which are able to penetrate solids or liquids. However, this treatment is not for everyone. It should not be used on patients who are pregnant, have active fractures or stress fractures, impaired circulation, deep vein thrombosis, cancer, or metal or bony implants. There are not many studies done on the effect of therapeutic ultrasound on contusions. Carr says that the studies are contradictory. Some studies state that the therapeutic ultrasound does help the healing of contusions, but some says that it has no effect at all. One study used a 5-minute application of continuous therapeutic ultrasound using 1 megahertz at 0.5 watts per centimeter squared. This treatment started on the day of the injury and, depending on the group, continued for 3, 5, or 7 days. This group that received the treatment for 7 days showed the most improvement and showed an increase in max force production by the muscle. This proved that therapeutic ultrasound promotes proliferation, protein synthesis, and cytokine production. Comments that I have about this research is that more needs to be done. In all the articles I found describing the effect of therapeutic ultrasound on contusions used mice as their subjects. This is because it is unethical to induce a contusion on a subject that is human. Delgado Diaz says that although there's been an interest in therapeutic ultrasound for tissue healing purposes for more than 50 years, it remains a contentious issue as little clinical evidence exists to support its use. More current research and research done on humans needs to be done.